Hello, thank you for joining our Facebook Live today. My name is Carrie. I'm with UnityPoint Health here in Dubuque. I'm here with Gretchen Hong, who is a nurse practitioner at our UnityPoint Clinic Women's Health location. We're going to talk about Lyme disease and ticks today. But first, before we jump into our topic, let's talk a little bit to Gretchen about your background. Tell us a little bit about yourself.
Well, first I'd like to say thank you so much for having me here. It's always a pleasure to do a Facebook Live with you.
We love it.
So my background, I'm a nurse practitioner and I specialize in adult care and also women's health care. I've been in practice for it is 10 years now that I've been in practice and at this location now for the last, 3 years now?
Time flies.
I know it, right? So anyway, and I practice over at the Pennsylvania clinic.
Good. So we're going to talk about ticks and Lyme disease today. So what's the connection? Why are we talking about this? Any special connection for you?
Well, there's a connection for me because, I'm a native Dubuquer, so I'm from here. And I grew up just past Sundown. So anybody that's from here is like, oh, I know where Sundown is. It's like our ski area. It's out in the boonies and it's got tons of woods and trees. Yes. And so I grew up there. It's my childhood home. And I spent a lot of my childhood running around in the woods. So for me, this time of year is like the perfect time to talk about something that not that I had Lyme disease as a child, but the ticks that I certainly remember finding and removing. Because this is that peak time of year for that.
Yeah, it is. It's peak time of year and they're out and about. And it's an important topic to get to know because you certainly don't want to have one and end up with some of the consequences. So,
exactly.
Lyme disease tick season typically starts about now, and how long does it last?
Yeah, well, the tick season actually starts in March and April, actually. That's earlier. It's actually earlier. The peak season is right now.
Okay.
So right now, like in the month of May, all the way through August, all summer long is tick season. So Lyme disease actually starts picking up right now because the ticks are actually starting to find people because we're going outside and enjoying the weather.
We finally have some
sun. Thank goodness, right?
Yes.
So we're out and about and we're enjoying it. Once we get rid of the rain, then we're going to be outside, hopefully hiking and enjoying the outdoors. That's just me. I like hiking, but it could be anything, outdoorsy, where you could be exposed to ticks. And where there's ticks, there are some of them carry diseases such as Lyme disease. So that's kind of what we're talking about.
Yeah, so is it a bacteria infection that the tick carries, or what exactly is it?
So Lyme disease is a bacterial infection that's transmitted to humans from ticks, and these ticks are the ticks that are usually found on deer. So if you are in an area where you find deer, you can look outside, like have a cup of coffee, look outside from your porch and see a deer walking by. You're probably in an area where you could get exposed to deer ticks and potentially contract Lyme disease. Okay. So or if you're out and about, like I said, if there's good brush, like if you're out in the wooded area, if there's trees, if there's bushes and brush, then you're definitely in an area where you could be getting it. So I keep thinking about like mushroom season where you go mushroom hunting. Like that's a great example of where you need to be protecting yourself.
Sure, that makes a lot of sense. So what happens if you do get a tick and that tick does carry Lyme disease? Is it guaranteed you're going to get it, or what kind of things are you watching for? What happens next?
That's a great question. So part of it is recognizing what are the symptoms of Lyme disease and how can we prevent you from getting it in the first place. And one of it is preventing the ticks from getting on your skin because they have to bite you and stay on your skin for about 36 hours before you typically transmit the bacteria. Now, not all deer ticks have this bacteria, so don't go running in thinking, oh my goodness, I got a bug bite. Not bug bite. I got a tick bite and I pulled the tick off and I think it's one of them. They're usually like really very small ticks. They're not like your usual larger ticks. So the symptoms if you got a tick on you, of course you want to remove it as quickly as you can because hopefully it's been less than that 36-hour window. So most people, if you get it off within a day, you're fine. If it's been at least a day, you're not really sure how long it's been there, then it's fair to kind of start watching for the next month because you could get symptoms anywhere between the first week to a full month later of the start of Lyme disease. And the important thing is that we want you to go in, if you get those symptoms, you want to recognize what they are and then get treatment sooner than later because the earlier you get treatment, the less likely you are to have this chronic Lyme disease.
Okay. Mm-hmm. So what are some of those symptoms?
So after getting bit, the signs that you probably would want to look for are, it feels kind of like sort of like a flu-like reaction where you get fever, chills, body aches, fatigue, headaches, and there's that Herald patch, or I shouldn't say Herald patch. It's like a bullseye rash where you can get, it's like a reddened area in the center looks clear, and it kind of starts migrating. It gets bigger and bigger. So that's really where you'd be like, oh, it's like telltale sign. That's absolutely what it is. So
does that have to be where the tick bit you, or could it be anywhere?
Not necessarily. I mean, it's usually around the site where you got the bacterial infection in the first place, but there are some cases where you can see that it's in multiple areas, and I can't imagine one person getting bit like 6 times to account for that. So yeah, it can migrate. You can have that reaction in multiple areas of your body.
Interesting. So what steps can people take to mitigate their exposure to ticks?
Oh, there's so much you can do, which
is
a good thing. So yeah, first of all is like when you're recognizing where you're going. If you're going out into a wooded area, you know that you're going to potentially have exposure, then you want to dress appropriately. So it's May through August. You got to keep in mind the temperature, but you want to cover as much of your skin as you possibly can, within reason. You don't want you going out fully dressed head to toe in like a snowsuit,
No,
and expect not to get heat stroke. You know, like you don't want to get heat stroke. But at the same time, if you can dress where you can, like I know they make lightweight long sleeve shirts and lightweight long sleeved slacks. And one thing I know I did when I was little is not necessarily fashionable, but you take your sock and tuck your pant into your
Yes, I remember.
But you tuck that in because they like you know, if you're walking through the grass, you're potentially getting out in your shoes, on your ankles. So I would do that. Some people go so far as to put like tape over their laces. You know, that I don't do that, but you certainly could. But yeah, you want to like any place where the skin could be exposed. So like pant to shirt, you want to tuck the shirt in. You know, long sleeves, like I said. And the other thing too is you want to make sure that your clothes are light in color. For 2 reasons. One is that it's hot out. So when the sun beats down on you, if you're wearing dark, you actually get hotter. So you want to wear something that's light colored. The other reason is that if you're wearing something that's lighter in color, if you get like a little spot on it, because you can see, like if it's a little deer tick, you'll see it. You'll be able to see it. Yeah, so you'll notice it sooner and you'll know.
And they're black.
So they're black. So they'll show up against clothing. So the other thing you can do to protect yourself is to use an insect repellent that is actually specific for, would cover ticks. Like I always think about DEET containing products, like the Deep Woods Off is like, you know, you can use that. I know a lot of people have concerns about that chemical exposures. There is some like oil of lemon eucalyptus that also does well. So there's lots of choices, but if you look at the label of something and it says like it works against ticks, it's probably just fine. You don't have to apply it throughout your entire body. You don't need to be like reeking of DEET.
Maybe hit some of those key areas.
Hit those areas that you think that you're probably most likely to get some exposure. So like I would like maybe behind your knee or on your ankle, on the shoe, where you don't get it on your skin necessarily. Maybe on like the elbow or like in your hair or something, like the back of your head. So you don't want your kids to have it on your face or something like that. So that's what I would suggest doing. Another one is keeping your yard free of brush. So like leaf piles, because they tend to sit in those leaf piles and like logs that are piled up. So you want to keep that clean and neat. If you can get rid of them, great. But if they're there for a reason, of course, use them. And some people use it for firewood and all. And then keeping the grass at like 3 inches or less. Because the ticks will still make their way through the grass, believe it or not.
What about like rocks or wood chips? Like if you have a wooded area, like separate, does that work?
Absolutely. So if you have like an area around your house that's got like a wooded area, you want to separate your yard from the wooded area. It just makes it harder for the ticks to travel. So if you can put in little roadblocks, you know, like a gravel area, like you can put wood chips or gravel and get good 3 feet before they get so tired that they turn back for the woods. That's how I see it. You get like a little break in there.
Yeah, their little travel path is interrupted.
And we do have the Heritage Trail here too. So if you end up outside, or like even Swiss Valley, you know, if you've got those wooded sort of pathways, you know, you've got a good at least 3 feet across. Try to stick to the center because you're less likely to get stuck by the woods or like brush up against plants where you could get exposure to tick.
That makes sense. Well, good. Okay.
So lots of things you can do. The other one too, I'm sorry, I'm like, hey, there's still so much more. There's so much you could do. Which is good. Another one would be, you know, obviously taking a shower. When you get back into that, when you get back in from your outdoors, keeping your equipment outside of the house, like your hiking boots and whatnot, outside so that you don't get them in the house. So that would be another one. Taking a shower right away would wash anything off. taking the clothes that you use outdoors and putting that in the wash.
Right away.
Right away. Or if you want to stick it in the dryer for 10 minutes, that usually kills ticks too. Yeah. So like I said, lots that you could do.
It is a lot.
Another one would be skin checks when you're done.
I was going to ask about kids.
Oh my goodness,
that's probably a big one for kids.
Oh yeah.
Check
adults too.
If
you can get someone to check your hair, you know.
Yes. I remember that too.
I do too. Like I have a lot of memories of sitting down on the floor and my mom's like, okay, it's time to check your hair. And you know, you sit down and she's like, you know, it was actually kind of soothing to have someone like messing with your hair, but it's not soothing when they're like, and there's a tick. But thank goodness, because you know, then they can remove it right away and be done with it. Yeah. You know, so that's always a good thing, is to do a skin check and do a hair check and make sure you don't have anything there. Sure. And including and this is also like pets. You want to see their pets, and you know, check your children. Yeah.
We won't bring our pets to you.
Oh, okay, that's good. Yeah, I can't help them. You know, a vet for that. It's good.
So if someone finds a tick, they remove it.
Don't panic.
Did we talk about how to remove it?
I don't think so.
I'm not sure if we did. Let's review that in case we didn't.
Oh, good.
So if we find a tick, how do we remove?
Well, that's my favorite part. First and foremost, do not panic.
Okay,
don't panic. It's just a tick. You'll be able to get it off. You'll be fine. And remember that it's so easy to panic. You got something
right. So, especially like tucked in your skin. You know, it's like
I know I'm gonna be like itching now. So what you want to do if you do see a tick, like I said, don't panic. There's some old wives' tales that you really should probably not be doing, like burning them is not a good idea, especially if it's still attached to you, because that's your skin right next to it and you could accidentally burn. Another one is like I hear about people putting Vaseline on them, and that also typically doesn't work either. Again, the idea is you want to get it off as quickly as we can, so that we don't transmit the bacteria. So, and usually the easiest way is to just grab a hold of it with a tweezer and just pull upward, you know, don't like yank it, but just like a gentle, I shouldn't say firm, let's say firm upward pressure, just pull up and it'll let go. And then you can chuck it and throw it
as far away.
Not in the house.
Yeah, exactly.
Flush it down the toilet. I don't care what you do with it.
Is there a need to save the ticks?
No, for like a month, no.
Yeah.
No. So providers aren't, usually I wouldn't be sending it out to pathology unless it's something unusual. So no, I don't think you need to save it. I would
get rid of it.
Yeah. Get rid of it. But yeah, that's usually what you do. You try to pull so that hopefully it just lets go. But sometimes the part of it doesn't exactly get removed. And if that's the case, most people panic at that point because they're like, it's still in me.
Right.
So you can try to remove it with those tweezers. I would clean the area with alcohol before you do anything else with it. But if you do want to try to remove those parts, that's fine. If you can't get them out, that's fine too. You can just leave it be. It's okay. Your body will take care of that. Okay. And so it's okay. But then you either way, you still want to watch for symptoms of Lyme disease. Right. So that's going to be that fever, the rash, the body aches, feeling under the weather.
Yeah. And then if they have those symptoms, go see a provider.
Absolutely.
Go see your practitioner.
Yep, absolutely. So you can go to an urgent care. You could go to your primary care provider. We're all very well versed in it. We know that this area does get those deer ticks, and we do see Lyme disease. And this is the peak season. So from May to August is when Lyme disease starts picking up. Yeah, especially like I said, when the rain stops and we're outside enjoying the weather. Finally. I know. Yes. I know. So
Okay.
It's easy to treat. It's just an antibiotic. Yeah. So it's pretty simple. It's better if you catch it earlier than later. If you end up, not that you wait too long, but let's say it's months later, you can get some long-term reactions. So it's best if you can get it sooner than later once you notice symptoms. If you don't have symptoms, you're done. You're in the clear after 30 days.
So 30 days is that window.
That's the window you think for a month. Like, I went out hiking that time and it was like a month ago, and now I've got this weird looking rash on my leg. Yeah.
Come get checked out.
Come get checked out. Yeah. It doesn't hurt anything to go in and have someone lay eyes on it and say like, oh yeah, that looks kind of unusual. That looks like Lyme disease. And, and there are blood tests to confirm it. If we are suspicious and we're not 100% sure, we can certainly, but it doesn't hurt to do antibiotics if we think that that's what it is. Yeah.
Well, good. Did we forget anything?
I don't think so.
I think
we've covered a bit. Yeah. And I talked a lot, so.
No, you did really good. But I think we're all going to be like, what is this?
Right?
You know, like that little crawly feeling.
Yeah, I'll just say too, like be aware, like look before the season starts, look at your body and look and see what your freckles and moles typically look like. Because you don't want to be looking at a freckle or a mole and be like, that's a tick.
That's a tick.
Don't,
No,
yeah.
Know your body.
Yeah, know your body.
Know yourself.
Ticks have legs.
Yeah.
Freckles don't.
That's a good point. Thank you all so much for joining us today. Gretchen, thank you so much. It's always a pleasure.
You're welcome.
So
Thanks for having
enjoy
me.
your summer, and thank you so much.